Welcome to the By Design radio program. My name is Dr. James Proodian of Proodian Healthcare and ProodianHealthcare.com, where health literacy is the key to longevity. And as long as God has us on this side of eternity, my show is designed to help educate you and your families to feel better, to function better, and live as many quality disease-free years as possible. Welcome with this week as we concluded osteoporosis last week. I've been doing some thinking about what I wanted to prepare for today's show, and I guess I can't help, like most Americans, turn on a TV or listen to a radio show, and the Affordable Care Act, otherwise known as Obamacare, is certainly front and center. The problems with the website not working, expectations of the cost of this program, the possible politicians giving us the wrong guidance, possibly lying to us. I'm the type of a person that kind of sits back and just sees it all as what it is, which is that we've got a system. It's called healthcare, and whether or not you want to believe that this was a government takeover of a large majority of our GDP or not, I'm here just to sort of, I'm going to focus on the why I think all of this actually is even happening, which is my field of expertise. As I have a degree in public health, and yes, I have other types of educational degrees behind me. But one of the things that I've done over the last 20 years is I've run a program called Wellness at Work. Wellness at Work is a public speaking, it's my healthcare education company. So I spend anywhere between 40 to 60 times a year, whether I'm corporate America or at a group or an organization, as small as 15 to 20 people, and I've spoken to as large as 1,000 people. So I'm not a novice to presenting information. I have been a keynote, or I've been a breakout speaker at the Garden State Human Resource Association for a few years. I've spoken at the NJEA conference down in Atlantic City. I've spoken at the Jersey Shore Human Resource Association. I share that background with you because HR and CFO type people have come to me over the years with reducing healthcare costs. This is nothing new to me, meaning that the Affordable Care Act and the reason behind it, which the reason was to not only offer more people healthcare coverage, and I'm not here to debate that or not, but it apparently was going to drive down cost, and we have a real cost issue. So I wanted to spend today's show kind of talking about my own personal experience and looking at rising healthcare costs and the reason why. Why is healthcare costing us so much money? What has happened in the last 10, 20, 30, 40 years? Well, we could start with an aging population. Obviously, the older people get, the more need there is for actual health care. We have an absolute epidemic of chronic illness. So we can't just say we're getting older. We have to address as a nation that there is epidemics of man-made, self-inflicted chronic diseases that are costing us as citizens a huge amount of money. There is increasingly expensive technology, and we can't underestimate the value or the cost of waste, overtreatment, poor coordination, poor execution, administrative complexity, price gouging, fraud, and abuse. Flat out fraud and abuse in the healthcare system. So recently there was some research published, and the fact that waste may account for 20% of all healthcare costs. I know as an American citizen who employs about 20 people, and I have a healthcare plan here, thinking that my healthcare coverage, the policy that I pay for my employees, my full-time people, that 20% of that might just go to waste for healthcare costs. Overtreatment accounts for $225 billion in excess costs. And 20 to 50% of all high-tech imaging provides no useful information and may be completely unnecessary. So one example of that overuse kind of imagery is, for instance, imaging for headaches in patients without risk factors for structural problems, like, for instance, PET scans, CAT scans, bone scans, in early or in staging early prostate cancer, early breast cancer, unless the patient is a high risk for metastasis. Physicians' fear of malpractice. Physicians order tests because they're afraid they're going to be sued. So the system is one that has to be taken apart, because the cost of our current healthcare system, whether you agree with the Affordable Care Act or not, is a system that is broken. The state of the United States, the state of health in the United States, from the Journal of American Medical, which is JAMA, data compiled from studying 34 countries over 20 years, that's through 2010, they provide us some statistics. Let me share with you some statistics with respect to chronic illness. Chronic disease epidemic continues to spread. The United States is doing far worse than many other developed countries, mostly due to unhealthy lifestyles, diet, and environmental exposures that constitute the American way of life. So we've adapted this American way of life, and we've actually exported it to a lot of other countries, and they're dealing now with epidemics of chronic illness like type 2 diabetes. So how does the United States compare to other countries? Well, during this study, our death rate went from 18th in the world to 27th. Our years of lost life due to premature death went from 23rd to 28th in the world. Our years lived with disabilities went from 5th to 6th. Our life expectancy at birth went from 20th to 27. And our health life expectancy went from 14th to 26. So as a nation, we are developing more disease. We are becoming sicker. And this study was over 20 years long, from 1990 to 2010. Once again, this is the Journal of American Medical Association. This is JAMA, one of the most prestigious journals in the world that studies incident and mortality and epidemiological findings in our country. So some key conclusions from this study was that morbidity, which means disease, and chronic disability now account for nearly half of the United States health burden. So that means 16 to 17% of our GDP is healthcare. Half of that is disease and chronic disability. Improvements in population health in the United States have not kept pace with other healthy, or I should say wealthy nations. So our improvements in population health, we have not kept up with other wealthy nations. And the United States spends the most per capita in healthcare than any other country, yet lags behind for life expectancy and many other health measures. Let's just stop there. We all just need to stop and take a look at the data and ask ourselves why. What is it that we're doing? What is it that happened to this country that we are spending so much money on healthcare that even now, whether you agree with it or not, we have the Affordable Care Act and all of the issues and problems that are associated with the implementing a project that size. I mean, implementing a program that size is going to have a host of issues. And what they are, I don't even know yet. I think I have my own opinion, but I'm going to save that for another day. We have to, as a nation, accept the fact that man-made chronic illness is accounting for the majority of these problems. That means we have to stop looking up and saying it's God's fault. It's not. This is man's interjection in our food supply, in the way we've developed a lifestyle, and the way stress is affecting each one of us. Remember, this show is dedicated or is utilized as Luke 1:37. For with God, nothing is impossible. That means no matter how bad the data is, we know it's in his hands, but it doesn't mean that we can't make better decisions every day for ourselves and our children. I'm a grassroots guy. Wellness at Work started in my neighbor's living room, where I would just start speaking to groups of people. Then I moved to Borders bookstores and Barnes & Nobles all over New Jersey, and then it escalated into corporate America. I mean, it's a grassroots objective, as this radio show is. It's supposed to just get people motivated into looking at some of the things that we're doing, looking at ourselves in the mirror. Just a couple of other statistics for you, kind of in this line. The fact that teenage deaths by poisoning has risen 91% from 2000 to 2009. Prescription drugs are blamed for this huge increase. Now, again, whose fault is that? Where are all these prescription drugs that teenagers are getting their hands on? Where are they coming from? Okay, well, a lot of it's coming from mom and dad's medicine chest. More than half, 57% of those poisoning deaths are among teenagers are now due to prescription drugs. Okay, so as much as child deaths due to injury are down 30%, child deaths from car crashes are down 41%. That's fantastic. But teenage death by poisoning almost doubled in the last 10 years. And it's just easy access to prescription drugs. And we should make no mistake that our healthcare system that is broken, and it is woefully ranked and is falling fast in our ranking amongst other wealthy nations, has something to do with our dependency on prescription medication, our dependency of a pill for every ill, as opposed to looking at human anatomy, human physiology, human biochemistry from God's perspective, and looking at the things that we were supposed to be ingesting, how we were supposed to be tempering stress, and how we were supposed to be using our physical body. So going back to my Wellness at Work program and speaking at various companies and looking at and evaluating various corporate wellness programs. Recently, I was just asked to be on the wellness committee in Long Branch. Now, Long Branch is a pretty big, good-sized town here in Monmouth County, New Jersey, and the wellness committee is doing just that. It's a municipality. It's looking at how do we cut down in healthcare costs by making our municipal workers healthier. Well, this is right up my alley. I've been doing this again for 25 years. We have to look at the fact that employees and employers should be utilizing the system less. So if we had 4 or 5 car accidents in a year, my car insurance would go up because I'm utilizing the system more. Health is similar. The more we utilize the healthcare system, the more expensive it costs. So workplace wellness programs definitely have their place. I'm not a big fan of most of what I see out there, I gotta be honest with you. But the ones that are good are really improving the health of their employees and lowering healthcare costs for the employer. We want to promote employee engagement. That means it's not as simple as handing somebody a brochure or telling them, take a blood test, tell them they have high cholesterol or your body fat percentage is too high, and then send them home with a list of things they shouldn't eat. It's a little more in-depth than that. We want to promote employee engagement by getting them educated. Education is where we should begin. Employees are more satisfied with their jobs. They're more likely to remain with the company and are more likely to recommend the company as an employer. This is the type of thing that wellness or employee wellness can do. With rising healthcare costs, employers see workplace wellness programs becoming more necessary. Employees perceive that the company does care about their personal well-being, and that's a good thing. Employees are not just bottom line. Employees make the company. And as an employer, which I am grateful and blessed to have my employees. I'm grateful and blessed to see them at my office every day caring for my patients and putting forth passion and customer service to care for other people. It also makes the employees feel better about their workplace. So if you're a business owner out there, you really should consider looking at what some very low-cost options are. By taking your employees to a different level, by providing them information, allowing them the resources they need to make better decisions about how they feel, how they function, and how long they live. And you know something? You can end up being the superstar. You know, the employer ends up looking like the rock star and the superstar because you just allowed the employee the ability to be healthier. Remember, a candle loses no light by giving light to another candle. We should be sharing our knowledge, our skills, and our resources throughout our communities every day. We should be sharing them. We should be giving them. And that's what living a God-filled lifestyle, a faith-based lifestyle is all about. Being a Christian, it's very important that we look at each other in our communities and provide resources. In my case, this is my skill set. My skill set is, for lack of, not much other than this, I can't hammer nails very good. I can't do plumbing, and you certainly don't want me doing any electrical work in your house. But basically, it's teaching people that, we have the resources available. We have the knowledge, we have the science. All it takes is an understanding that what we're doing, and some of the statistics I shared with you today, are just so woefully harmful that we have damaged the very fabric of our healthcare and our healthcare system, so much so that now, whether we like it or against it, but Affordable Care Act and Obamacare looks like it's here to stay. And what that means for all of us, only time will tell. Thank you for listening to the By Design radio program and joining me, Dr. James Proodian, this week for this episode. If you'd like more information about me, please go to ProodianHealthcare.com and submit any questions you have for the show. If you'd like me to come out and speak to your company, please contact me. We could arrange it. I do 60-minute and 90-minute presentations. I also do half-day workshops. God bless you. Have a blessed week, and hopefully you're considering some of these changes.